and welcome to Arlington County's newest show, COVID Conversation. We are here tonight for an honest conversation about a year of COVID and the vaccine, and particularly getting doses into arms, as has been said. I'm Board Chair Matt de Ferranti, and I'm happy to be joined by a couple of faces that I suspect you're familiar with, a few folks out there, JD Spain and Carlos Velazquez. Thank you both for being here tonight.
Thank you, Mr. Chair.
Thank you for the invitation.
It's great to see you both. And before we really get going, I'm going to take just a quick moment to provide an update on where Arlington is in the vaccination process. We're working our way and we're accelerating our pace of work through phase 1A and 1B priority groups. That includes healthcare providers, residents 65 and older, and residents 16 to 64 with underlying medical conditions who have pre-registered. We have a significant uptick last week in the number of doses from about 5,000 to about 8,500. We're going to see an uptick over the coming week, the coming days, in the number of doses that we have. And we're also working through frontline essential workers identified in phase 1B. We started sending out notifications to public transit personnel, mail carriers, and those necessary for the continuity of government. Let's start getting to know our guests tonight. Can you tell us, each of you, tell us a little bit about yourselves? JD, do you want to start?
Sure. Good evening to everyone, and thank you, Mr. Chair, for the opportunity to be with both you and Carlos here this evening to have a really good conversation about COVID-19 and our vaccine rollout. I am Julius Spain Sr. Many people call me JD, native of Conway, South Carolina. Been living in Arlington since 2009, retired from the Marine Corps 2016, and I've been the president of the Arlington branch NAACP since January of 2019. I'm also the regional vice president for the Virginia State Conference of the NAACP, where I oversee 13 branches of the NAACP in Northern Virginia. Live in the Penrose community, definitely involved, and again, it's a pleasure to be with everyone this evening.
Thank you very much, JD, and thanks for your leadership of the NAACP. I know you've grown the number of members quite a bit in your short tenure, so thank you for that. And I will say I'm happy to be one of those members.
We're glad to have you.
Thank you, thank you. So Carlos, give us a sense of yourself, and you've been in Arlington as well for a good period of time.
And thank you, Matt, for the opportunity to be with you this evening, and JD, it's good to see you. So I have been a resident of this area for 21 years, and I've seen a lot of changes in Arlington. Professionally, I'm the president and CEO of HMA Associates, but I volunteer with a lot of different efforts, including the county's effort to be able to vaccinate everyone in the county. And I also sit on the Arlington County Commission on Aging.
Thank you very much. And Carlos, you long time on the Arts Commission, the Commission on Aging, and it's great. I know you have lived in different parts of Arlington, but it's also great to have you, I know now in the western part of Columbia Pike, and just grateful for all your service and leadership for Arlington County. So it's been a long year of COVID, and wanted to talk a little bit about the biggest challenges you faced as you balance work and family and everything. And on this one, just why don't we start with you, Carlos, as to, you know, it's totally changed. Not all of us knew what Zoom was, the phrase social distancing, 15 months ago, we might not have known it all, but what's been sort of the bigger challenges for you in this past year plus of COVID?
So two challenges have surfaced from the onset. One, that a lot of the clients that I have actually had to close shop or reduce services considerably. And so within the first 2 months of when the pandemic was announced, I lost about 70% of my work. And so I had to pivot quickly and to make my small business thrive, and that has happened, and I've been very fortunate for that to happen. But also, I've had 20 friends test positive, and I've lost 10. So it's been a very difficult year. So having to learn how to operate in a very different reality using technology has been a challenge, but one that we have met well. And actually, March 30th is the anniversary of when I actually helped coordinate within the county and the Commission on Aging community conversations similar to this, but a lot more people. And there's this thought that older adults perhaps have this digital divide where they may not necessarily feel comfortable with something like Zoom. And I actually put a cap on the number of people that could get into the system. And believe it or not, all these older adults learned how to navigate around the whole system. And we had over 100 people online, and their comments and their insights made a huge difference. And so I've been doing a lot of work, not only in the county, but across the state, trying to navigate around issues around misinformation and distrust for the vaccine, and learning how to really get people to listen to facts and get them protected with the vaccines.
Wow. Well, that's a testament to you that you pivoted your business and you're still making a difference by getting out the word about the vaccine. And then, you know, humbling, and we should pause at least to acknowledge losing 10 friends is a huge number. And I think we have to, I am very sorry. And even as I may not have had control, I want to honor, you know, many watching have also lost family and friends. And we do best when we respect the challenging moment, really, and the challenging year it has definitely been. So that's a thought. And there's no great way to keep going, but clearly you have, and we seek to honor the conversation by safety, as you've already worked on, and trying to help people avoid infection. So JD, your biggest challenges over the last year, leading I know you also got a day job, and you got the NAACP local chapter, and you are busy. I see you in a lot of spots. So what's been the biggest challenge for you this year?
Yeah, well, thank you for the question. And I too, my condolences go out to you, Carlos, and to everyone who's watching who perhaps lost a loved one or a friend during one of the most tragic times of our lives. So we've been going through this together. For the NAACP, and I'm going to keep it pretty central around the NAACP outside of work, because I've been able to adapt in what I do as a consultant in the acquisition intelligence field, and work from home for most of the time, which has been great. But the NAACP, we've seen some strides, actually. And it's forced us, the pandemic has forced us to communicate in means like Zoom, change our way of meeting. And we've been okay, right? Some of our branches in the region have stepped up, but here in Arlington, we've seen our membership grow. We've seen people engage quite a bit with during this time of COVID, when they've been, of course, locked down, I would say, in their homes. But I also want to point out that what we saw in 2020, along with the COVID-19, as far as the NAACP, was a lot of, you know, let's say the unfortunate murder of George Floyd. And that, too, I would say, galvanized a lot of momentum and activism in the NAACP. And we're happy to what the county board has done, and many others in the community, to get us in a better place. But let's be quite honest, you know, COVID, as we know, unfortunately, the death rates of Blacks and Latinos is at a very alarming rate, and it's been such for over a year. So, you know, along with the emotional and mental strain that many's been going through, we have to understand that. So I've been trying to lead with empathy, right? And letting people know that I understand, and doing my best to kind of make a way out of no way, right? And let them know that together we will get through this. So that's been my year.
Wow, thank you for that. And, you know, I'm reminded as you were speaking of a quote that I heard a little bit ago, and you will both be familiar, is where Michelle Obama said about her husband that the presidency just reveals character. It doesn't develop character, it reveals character. And both of you have spoken to your own, the challenges that you and your organization faced, and also the work you did to work through it. And so I'm grateful for that. And I know that as I think personally about the biggest challenge of the last year, for me, it's really been around a reckoning with respect to fairness. Racial equity it was revealed in 2020 that we haven't been where we want to be, and we knew that abstractly, but we saw it in front of our eyes, clear as day, last year, and that is relevant to the vaccines because we have much more work to do to equitably distribute and make sure that our communities that have high infection rates and high fatality rates are getting the vaccine. So it's what keeps me up is thinking about vaccine equity. And last I checked about 4 days ago, we had lost 242 Arlingtonians to COVID. And so much more to do. So really appreciate both of your thoughts on that. And it also fits with the action that I know each of you has been engaged with respect to the Complete Vaccine Committee and the CVC. And that's a big group. This past week, I got to go to a COVID pop-up event in the Barcroft Apartments. And that was fantastic because we can handle Zoom and Teams, but we love being in person too, even if it's from 10 feet away. So on that front, what have been rewarding experiences or experiences related to the Complete Vaccine Committee that you might want to highlight? And for this one, I'll start with you, JD, and then we'll go to Carlos.
Well, thank you for that question. And the Arlington branch of the NAACP is happy and excited to be a partner with the Complete Vaccine Committee. At our last meeting, one of the leaders in our branch, the Reverend Delisha Davis, who was kind of leading this on our behalf through many other partnerships, told us, informed the membership that we had over 100 and some citizens who had registered to take the vaccine. And that was a good news story, right? Despite knowing there's so many more that we need to tap into. But as I look at the Complete Vaccine Count Committee and see all the partners out there, I'm reassured that we're going to be okay as long as everyone carries a little bit of the weight. So there's a lot of work to do, but we are. That was a good news story for us. And I can only imagine, since we had that meeting a week and a half ago, that we've probably registered 100 and some odd more. But working together in tandem again with our partners, I'm quite sure we're going to get this behind us.
Thank you. That's very helpful to hear. And Delisha Davis is a great leader who I've gotten to know, and it's great that she was mentioning the progress. Much more to do, of course. But Carlos, anything stand out as a moment that you treasured, appreciated, either with the Complete Vaccine Committee or in your work that you mentioned about reaching out and the communications work on COVID that you've been doing?
It's an interesting question because this particular effort is replicating the successes of the Census Committee. And I don't think, actually I know for a fact that the county had never seen that level of participation. And to have such a small number of households that weren't counted means a lot. So the model is worth replicating. And the reason it works is because we actually are engaging trusted messengers in the community. So people are more likely to open up to individuals to the idea of at least registering for the vaccine. And I've had an opportunity to talk to several people. And as I'm filling out or helping filling out the platform questions, I will often ask, have you been impacted? Or what do you feel about the vaccines? And they talk to me. The people start talking to me, revealing a lot of their concerns, what's happening. But it also is a reminder of the disparities that do exist in our community, because the pop-up events often are married to other efforts that are being organized to provide services, whether it be food or rental assistance to people in need. And so being able to hear people's stories about what is really of concern to them beyond COVID says that it's impossible to be able to tease out, the concern for COVID and what it means to have a roof over someone's head, or where their next meal is going to come from, or how can they get medical attention, or are there transportation issues that need to be addressed. And so being able to talk to people one-on-one in a way that can honor their trust and being able to have them tell me their stories has been greatly moving for me, and a stark reminder there are so many needs that exist in our county. That's what I've been getting out of the experience.
Wow. I mean, there's a lot of talk about the importance of stories, and everyone has a story, and hearing it is a big honor. And you pointed out that the pre-registration tablets, the iPads sometimes that we've been using, they take more time than we might wish, because we really want to overcome any concern people have. Certainly I was at the Career Center, and I was like, I was so eager to get the folks I was helping through so that they would be pre-registered and on our list. So that's part of what we've been working on. I do want to just take a quick second before I ask another question and continue the conversation. It's just to mention vaccinate.virginia.gov, or that's where you can go to pre-register, or you can call 877-VAX-VA-IN, which is 877-829-4682. And if you're not pre-registered, it's really we need you to be pre-registered so we can get help to you. And so I wanted to kind of ask a little bit of what you two are hearing when you think about folks you talk to in the groups that you are active in, your communities, and we all have multiple communities that we engage with. Is there anything you're hearing in particular of concern or of note? And I'll start that one with you, JD. If anything stands out.
Yeah, so again, thank you for the question. I think what stands out in the communities that I kind of speak with on a day-to-day basis is still this conversation we're having about trust, right? And if everything is being done from the government side to ensure that the communities that are disproportionately affected the most by this COVID-19 pandemic are being taken care of. Carlos alluded to a little bit about health disparities, a long story history by which none of us need to repeat and kind of talk about, that we all know about. There's been these disparities in the way the minorities communities have been treated for decades. So the question has been coming to me, what is the county doing, JD? Can they do more? Why aren't they here? So, Matt, we've been asking the hard questions, trying to be understanding. I have more individuals in the communities that I engage with that want the vaccine than any that don't want the vaccine. So, again, a lot of people want to get the shot. And I think we'll be better off to kind of measure later on once we get, the vaccines in, right? And everyone will get, a couple of these phases down the road. But for right now, there's still a lot of angst. There's still a lot of people who are anxious to get this vaccine. They're just waiting. For those that are watching this today, I will tell you, I was fortunate. I'm under 65 with an underlying condition. But guess what? I got my vaccine. And I would encourage you, if you're watching this, to go out and register. Register now. We need to get this behind us. And we're only going to be able to do that if everyone in this community does their part, and that means going out and getting vaccinated.
Thank you, JD. And I welcome. I don't always finish within a day when you've been in touch, but I do welcome, because we have to make a measurable difference. And we know that in Arlington, Destination 2027 showed a health disparity that we have to address.
Yes.
And we also know just intuitively that the signups have been being done by computer. And so if you're not sitting behind your laptop or your computer, it's harder for you to get pre-registered. And so we have a responsibility, and we made some progress, but we've got to make a lot more. I want to hear, Carlos, as your conversations, what are you hearing as concerns over the past few weeks?
I'm going to address your question a couple of ways. One, I appreciate the quotation that you made reference to from First Lady Obama about the unveiling of character. But I think there was a second part to that quotation that talks about the unveiling of gray hairs. As you know, our dear president left the office with a lot more gray hair, and I've had more gray hair grow on my head than ever before. So it has been a traumatizing year in many ways, and I think the gray hair is a result of that. But I'm also hearing two things about the unveiling of truths, about the inequities that exist in our communities. And I hear that more from some of the community leaders, those who understand what is happening and are able to voice their concerns. We're seeing a lot of truths, a lot of inequities, a lot of disparities that are even more unveiled than usual. But I'm also hearing distrust and comments from some of the people that have lined up to, for example, some of the food distribution sites. And I've heard people say that, the vaccine might cause birth defects. And so when I hear those kind of responses, it's not my job necessarily to try to counter the information, but rather at least lead someone to where they can get evidence-based medical factual information. And so it's really important that when we hear misinformation or people who believe something that we know is not true, as opposed to going after them and saying, that's wrong, how can you believe that? Just leading them the way of being able to get connected to websites and resources that can provide medically factual information. And I think that's the beauty of the resources that have been developed in Arlington County, as well as the state, that there is information that can lead people to medical information and truths. So I would say that in order to counter misinformation, it's important to not necessarily just hit them with facts, but also with stories that matter. And when people can hear your own story about what's, the impact of COVID, and I tell people that about what's happened in my life, they start listening in a very different way. But it's so important not only for us to tell our story, but also listen to the stories of the people that we're engaging within the community.
That is a powerful point that I've the last week has revealed to me yet again. I've been engaging, there's a group of PTA moms that are ASHPA, it's called, Arlington South Arlington Hispanic Parents Association, I believe. And they have a WhatsApp chain with about 550 members. And, I'm not that old, but I am not, WhatsApp is relatively newer to me. And so, they shared with me how important it is amongst some of our Latino neighborhoods that there's someone in the community. Just the fact that I speak some Spanish, not even close, to helping validate in that way, as we've heard of some of the concerns about, I know there was a Washington Post article about Latina moms or prospective moms concerned about fertility, and just providing the information of what we know about infection rates and also the consequences of maybe not taking the vaccine. More information really is critical. And so that's a good point. We have two partnerships this week, and I want JD, I want you to get in and kind of share your thoughts on these. We've memorialized two partnerships over the past week to 10 days. One with Neighborhood Health, who's working out of Macedonia Baptist Church in Green Valley, and one with the Arlington Free Clinic, which is halfway down the pike, just a block off of Columbia Pike. and both are seeking to get into networks that can just provide that added information that I think is necessary. Honestly, I'm not hearing a ton of hesitancy as much as information needs to be put before people. So those are two partnerships, and I'd be curious, JD, your thoughts on where we are. Those are probably good steps, but not near enough.
Yeah. So again, that is a start, and I can say I'm just going to speak specifically about the traditional Black community / family, more especially down in South Arlington and the Green Valley area. Using places like the Macedonia is a known way to kind of get in and expand within the Black community. So I greatly appreciate where we're at there. So working with any traditionally Black church in South Arlington tends to lead help out a good bit. But I will also say, just to back up a little bit, relying heavily on internet creates some barriers, more especially for our older populations in the Black community, because many of them don't have access, so they just don't. So we have to do that door knocking, right? Similar to what the census team has done in the past. And I'm happy to know that even down in Macedonia, they're going to be doing some of that. And the Arlington Free Clinic, of course, they have a network. So I'm very appreciative of what they're doing. I think that's a good step forward. What I would like to see is, perhaps a little bit more outreach and how that looks. I'm not going to pretend to tell everyone how to do that, but there's a couple more churches down there, right? So whether we're talking about Lomax or Mount Zion in the old Johnson Hill area, there's those areas. I would say we probably can set up shop, but I know it's going to take some time. But I'm happy of where we're at thus far.
Yeah. All right. Well, that's good. I share some happiness that we're working on it, and we've developed these two partnerships with networks. But there's also, I believe, we're going to need to door knock and do so safely with masks on, and we're also going to need to do. One idea is a set of really short, not TikTok, but like that, a very short. Here's my why of why I got the vaccine, and I'll start with my. I do want to just ask you for each of your whys as to why you. I have not gotten the vaccine, but I hope to get it soon, and I am eager to get it. And my why is I'm 47. I just got married. My wife is ready for me to get the vaccine because she knows that I want to be out there in the community. And she has seen plenty of me around the house. So, we're happily married, but it's also true that she doesn't need to see me pacing around all the time. So that's why I will get the vaccine in order when I am able, and I'm not cutting any line. I'm doing it in order when it's appropriate. But I know, thinking of you, there's so many folks we love, my parents, getting to see them again in person. Getting to hug my sister. Those are a few whys. And what about both of you? Why don't we start this time with you, JD, and then we'll go to Carlos. Is there some particular motivation that helps you get through this and keep leading forward?
Well, thank you for the question. And to answer it quite simply, JD, why did you get the shot? Because I believe, more especially when you're in a position of leadership, you have to set the example for others to emulate. Again, notwithstanding all of that, I am a high-risk African-American male, and had some underlying health conditions from the military, and registered and got the shot. I was ready from day one. And for those of anyone who served in the military, I'm not going to sit here and share my health record, but say, guess what? We get multiple shots. I served in Iraq, and I think I got 7 shots for the anthrax. I'm still here today. And what I try to share with individuals who question or want to pause and get more to what Carlos said earlier, refer them to, places like the CDC or to Virginia Department of Health. And I also try to share with them my experiences with vaccines over my 48 years of being, so I got you about 1 year, Matt. That is okay. Science and technology is not where it used to be 30, 40 years ago. We're in a better off place. So I trust the guidance coming out of the CDC from competent leaders like Dr. Fauci and then our, the President of the United States and many others that are not into politics that have went ahead and took the shot. So that's what I try to do. And of course, I want to live, right? And there's a risk associated with that, with not taking a shot. And I tell folks, I'm not rolling the dice with my life, right? And that, to be quite honest, I think taking the shot, it's been tested, it's been tried, and we want to get back to normal. So that's why I took it.
That's great.
Yeah.
Thank you for that. And I also will say that I think that it's important. There's a particular extraordinary power in the leadership of our Black communities taking the shot because of the history from injustice is still with us, but it's important that we have leaders of color and taking the shot, and you've said it so well. And in that one, I'm no chair, I'm the ally in this case, trying to support the work that you are doing. And Carlos, what sort of motivates you to get your shot here? I know it's coming up shortly, so what's motivating you in this leadership, in this work?
Well, my why is about protecting the ones I love and care about in the community. But I also want to respond to a comment you made, Matt, and that is that while it's important to have these partnerships like with the PTA, that's excellent, but a lot of the parents are connected, and we need to push ourselves even harder to get to the people who are not connected, who are invisible. A lot of Latinos have 2 or 3 jobs, and it's a struggle to get to any place that they can either find access to a laptop or a tablet, go to any of the pop-ups that we're organizing. And oftentimes it's even more of a challenge to even be able to set up an appointment to get vaccinated. So I think we need to all work a little harder to get to those who are invisible to a lot of us who are not necessarily connected to groups like faith-based organizations.
Thank you for that. That's very true. And I think of so many who are, if you're working 2 jobs, you don't have time to even often talk with people. And there are individuals at all ages, our seniors, also some who are in their 20s who are single, and they can't see people in person as often. And so we need to make sure that everyone counts on this critical challenge of getting out the vaccine. So just a big thank you to you both. As we close, I want to remind everyone here, and I think both of you I know are aware of this, that it's still so critical to wear a mask, keep 6 feet distance from others, and wash your hands, even if you're vaccinated, because the science is not 100% clear as to whether you can pass it to someone else, even if you don't get sick. But also in this moment in Arlington, we have a positivity rate under 5%, but we know that there are variants out there. And until we make sure more and more of us are vaccinated, we need to take those simple steps for the coming month and months. So with that, JD and Carlos, thank you so much for taking time and for your leadership of the community and sharing your stories and our conversation today. With that, I'll wrap this up. Thanks for being with us out there tonight.
Thank you.